thanks again, everyone, for tuning in today. I know it's a smaller group, but hopefully that means if you have questions that we'll be able to get those answered before we end today's session. So my name is Ashley Eilenfeld. I work for ProHealth Care in the Community Benefit Department and have been helping coordinate some of these presentations. But really, why you're all here today is to learn about nursing in labor and delivery. I know this is always a really popular one for our students. So we are lucky enough to have Stephanie Peterson here today, who manages that unit at ProHealth Care. So Stephanie, I'm going to turn it over to you and have you more formally introduce yourself and then talk about your role at ProHealth Care.
Sure. Thanks for having me, Ashley, and thanks for joining everyone. My name is Stephanie Peterson. I am an RN at ProHealth in our labor and delivery unit. I have been a nurse now for 15 years. I started out as a bedside nurse in med-surg. I went to the emergency department. I eventually went to labor and delivery, and I've worked my way up the chain of command here and became the manager of the unit at ProHealth in Waukesha and in Oconomowoc. So I absolutely love my job. There's nowhere else that I would rather be. If you have an interest in nursing and you think this is the place that you want to be, I highly, highly recommend it. It takes a special kind of nurse to be a labor and delivery nurse, and so we'll kind of touch on that a little bit through the presentation. But like I said, it's a great area to be in. So, sure. So let's see if I can get this to move for me. So education-wise, to become a nurse in general, there are two basic degrees that a nurse can have coming into this field. So when you graduate from high school and you apply to colleges, you can either go for an associate's degree or for a bachelor's degree. An associate's degree is a 2-year schooling for nursing, and then a bachelor degree is 4. After you finish your bachelor's, you can also move on to your master's. Some people even continue on after that with advanced education and use their nursing degree to become a family nurse practitioner, or we work with neonatal nurse practitioners in our NICU. And then, as you saw from all the letters behind my name, there's also certifications that you can get within your the difference between these degrees are a few different things. One of the big ones is that hospitals are what they call there's magnet hospitals out there, and those are looking for nurses with bachelor degrees. They work more in the areas of teaching, and so they will reach out to those with a bachelor degree versus an associate degree. I will tell you that I have worked with a lot of great nurses who have associate's degrees, and as they get into the field of nursing, they tend to go back to school to do their bachelor's degrees after. This is a great way to get your foot in the door, become a nurse, and then use that education that you've learned in the bedside nursing to finish and get that higher degree of the bachelor's versus the associate. One thing about nursing that's common for all of these is that once you graduate from nursing school, you'll have to take an NCLEX exam, which is what all nurses talk about. It's the big exam that gets your licensure. So through nursing school, no matter which degree your goal is, you have to have a certain number of courses. You have to have hands-on experience. A lot of schools have what's called a capstone. So you get to the last semester of your schooling, and they help you reach out to a preceptor in the area that you're interested in nursing so that you can get a little bit more of a hands-on experience in a hospital one-on-one with someone who's there to really help you get experience in that area. So that's a great part of nursing school. So a day in the life. I can kind of talk about the difference between my main responsibilities as a bedside nurse versus management. Bedside nurses in labor and delivery are assigned for the care of a labor patient. AWONN, AWONN, is the governing body of nurses in terms of talking about patient ratios to staff and guidelines in terms of safe patient care. ProHealth is very big on safe patient care. We very much so stick to the guidelines so that we can provide our patients with the best bedside care that we possibly can, and ensuring healthy outcomes for both our moms and our babies. This is also for our nursing staff. We care about our nurses. We want them to be comfortable in the environment that they are. We want to decrease the amount of burnout, and let them provide what they feel is the best care for their patients during their shift. So that's super important to me, both as a bedside nurse and as a manager, that we abide by those guidelines and do our best to provide the best care that we can to all of our patients. What our bedside nurses do is they provide one-on-one care to the labor patients. So this means we do things like starting IVs, and we use monitoring systems to understand how monitoring a baby while they're in utero, so in mom's belly, and how that equates to where they are in the labor process. So we do a lot of education. This is one of the things that makes us such a specialty, is that there aren't any other places in the hospital that you would use this type of education. So we're very big on making sure that we're abiding by those standards and that we're constantly educating our staff, whether it's, ongoing classes on the unit, offering classes outside of the unit, using our staff meetings to continue our education, just so that we can assess and assist our patients in the best way absolutely possible. What's different about labor and delivery versus other places, if you think about if you go into a med-surg room and you're caring for a patient, right? You see your patient in your bed. You can say, oh, I'm taking care of this patient because they have a broken leg. What's different for labor and delivery is you have the patient you can see in the bed, but you also have the patients that you can't see. So you really become the eyes and the ears of the physician, right? Because the nurse is the one who's watching your fetal monitoring. The nurse is the one who assists the patient, who comforts the patient, who can read that fetal monitoring to kind of tell where the patient is in the stages of labor, so that you can work collaboratively with physicians to care for those patients. I had alluded to Ashley earlier that actually my first goal going to college was actually not to be a nurse, it was going to be a teacher. And as I got through the process of becoming a teacher, I was like, this is not what I want to do. But what I love about nursing is that the things that I loved about teaching are also a part of nursing. So there's advocating for your patients and their unborn child. It's also educating your patients and teaching them when their child is born how to care for those infants. And so this is a great way that you can get the ability to teach, to help, and to be proud of the skills and the education that you've achieved to reach out to our community and help others in a great time of their life. A lot of, when we talk about AWONN and expectations, I did put in here that there are expectations of charting. There's legal aspects of healthcare, things that we have to chart and understand, so that we can protect ourselves if there was ever a bad outcome, and understanding how. So when I kind of take the roles between manager and bedside nurse, as a manager, I need to look out for my team to make sure that those things, the expectations, our staff is understanding, so that as a bedside nurse, you can also complete those tasks. In addition to my main responsibilities, if I were to work on the floor would be, as a manager, I do all the hiring. The thing that I say to most people when they come in and they interview, and this is my secret, and it's not really a secret, but I can teach anyone to be a nurse. I could teach you how to put in an IV right now. I could teach you all about fetal monitoring, but the one thing I can't teach you is how to be compassionate, right? So if you have a passion for caring for others, if you have a passion for the area that you're in, this is something that no class can teach you. And this is really the big part of nursing itself, is having that compassion to drive you to be the eyes and ears, to be a great advocate, to be a good teacher. And I think that's really the basis of being a good nurse. So on that note, so I do the hiring, I manage a budget. So that means taking care of ordering supplies, having the equipment that my staff and physicians need, making sure I'm following that budget so that I still have a job because I'm not spending too much money. And then we also have to follow the guidelines of the Joint Commission. So the Joint Commission is kind of that overseeing big brother, like the Wizard of Oz out there, that comes into the hospitals to make sure that we're providing safe patient care. So we have guidelines that are presented out by the Joint Commission. Every 3 years, they give us a nice surprise visit and come in and check out our unit and check everything out and just kind of give us pointers if there's something they think we can improve, or let us know what we're doing that's well. So that's kind of always out there on our table. I also do staffing. I work as a manager with my charge nurses to ensure that our patients are being cared for appropriately and that we have the right mix of staff on each shift. What's different in our unit versus other units would be that, let's say you're on a med-surg unit and they have 20 beds. Well, you can kind of rest assured that you need staffing for 20 beds. For me, patients come and go pretty quickly. We never know sometimes when patients are going to come in. So we have to staff a lot for the what if and the unknown. So that's something that's different for us. Excuse me. I am also in charge of education, making sure that all of our staff are educated on the most up-to-date guidelines, and that I'm providing them with resources to continue to learn in their practice. We then get down to patient satisfaction, which is a huge thing, right? If you went somewhere and you absolutely hated the way you were taken care of, you wouldn't go back there again, and you'd tell all your friends that you hated it. So my job is to also round on all of my patients to make sure that they had a great stay, all their questions were answered, and to see if there's anything else I can do for them while they're within our walls at ProHealth. Along those lines, ProHealth is great about being a community advocate also, and I'll kind of talk about that a little bit further, but we also do things where we work with different partners in our practices, whether it's the family practice physicians, OBGYNs, those are the doctors that, obstetric doctors that provide care for pregnant patients. We work with anesthesiologists who provide anesthesia care for our patients while they're in labor for pain relief, or in our ORs if we would have to go into the OR for a procedure. We also partner with lactation consultants, and these ladies are fantastic. They, along with our community education nurses, provide prenatal classes, postnatal classes to talk about caring for yourself, caring for your baby, and breastfeeding. ProHealth is really great in being out there in the community. I will say that a lot of these people are involved in a lot of programs. As a leader, I sit on boards on different community resources and benefits, just to partner up to make sure that the people that we're serving in our community are getting all the resources that they're really looking for. So a typical shift for a bedside nurse Most nurses work either 7 a.m. to 7:30 p.m. and we go by military time. That's why I used the 1900, or 1900 to 0730, which is considered night shift. So 7 p.m. to 7:30 a.m. These are typical hours for a nurse that works in a hospital. There are some hospitals out there that do 8-hour shifts, but typically most nurses now, if you look, are doing the 12-hour shifts. A full-time employee works 3 12-hour shifts a week, which is really nice. So that means you have 4 days off in the week, and then you work your 3. Our unit itself works every third weekend. So you can lay out your calendar and know when you're going to work on the weekends, so you can plan fun stuff and trips in between. Myself as a manager, I work 40 hours a week. Most of the time that's 8 a.m. to 4 p.m. But I can tell you, in all honesty, it's usually a lot longer than that. Managers and above are expected to have 24-hour day coverage for emergencies. So I get calls, if the staff feels like their staffing ratios aren't good, if they feel like they need assistance with something, any type of emergency, I have to be able to answer my phone to help my staff. So that's one thing that's different between management and being a staff nurse. Staff nurses, once you're done with your shift, you're really done with your shift, and that's it. We do sometimes call out and ask if there's people that want to pick up overtime, but that's not an expectation. It's just an ask. So our patient population that we see, usually in labor delivery, is women. We don't have any male patients. They're all in the age range of 12 to 50 years old. Of course, we all take care of babies. We love babies. A lot of times people will say, well, don't you just sit around and take care of babies all day and snuggle them? Well, no, we don't. We really try to keep moms and babies together throughout the process of being on our unit. So ProHealth is very big into that bonding period. So our nursing staff and our CNAs and our physicians, we really work around the schedule of the mom and the baby once baby's born, so that we can assist them in figuring out how their day-to-day cares of a baby would be once they leave our hospital grounds. Another thing that's different about our patient population versus anywhere else, if you think about going to the hospital, right? You think, I'm sick and I'm going to go to the hospital. But our patients, for the most part, are all healthy. We do get some very sick moms, unfortunately. But for the most part, they're walking, talking, can do their daily things of living without any assistance. So we have to keep in mind that we're there to assist them versus complete cares of those patients in that postpartum period. On a busy day, on a really busy day, I think in my career, the most babies I've ever assisted with in deliveries is 6. And those were all different moms that delivered. That was a very, very busy night. The most babies I've ever delivered at once is 4. So I had a mama who came into the hospital pretty early in her pregnancy, and she was pregnant with quads, so 4 babies. And she lived with us in the hospital for almost 2 months until she delivered all 4 of her sweet babies. She does live in my neighborhood. I found out as I cared for her. And so it's really neat to see how that care that we provided assisted her through that pregnancy, so that she was able to take home 4 healthy babies. So it's rewarding every day to just see them and know that, you know what, I was a part of that. I helped them, and this is what she gets for a lifetime. So I would say this is probably one of the most rewarding jobs you could have. On those lines, being part of that time, I really feel is my favorite part of the job. we get to see people at their absolute best, and we get to see people at their absolute worst. We are there as an emotional support person, but we're also an educated support person, right? So that's where I take the skills of, this is what I've learned being a nurse, and this is what I learned really being a teacher, and how I can take those together to put them together for the best outcome for all of my patients. I think that we are always learning new skills. The ladies on my unit all do a great job of looking at outside resources, finding education, finding new things. Like, the internet is amazing of what you can find. And we do things where we have, a staff meeting every other month. And I'll say, okay, what do you guys have on the docket? What have you looked at? Does anybody have any ideas? Is there things that we want to share with other members of our staff, so that, we can grow in our practice? And so just having that collaboration to help each other learn new skills and grow is amazing. So we've touched on this a little bit, but skills that I think that are very necessary are definitely communication, right? So communication is important because you're going to communicate with doctors, you're going to communicate with other nurses, with patients, with their families. You're the advocate for your patient. Dedication is one of them because, like I've said, it's a lifetime of learning to become a nurse. So it's not like you go to school and the day's over and, you have a certificate and you're done. Things change in practice. We've really grown over the 15 years that I've been in this to see how what we do during labor can change our outcomes, to improve our outcomes and to improve our patient satisfaction. So that's really important. Along with patience and kindness, willingness to learn, and especially being a good listener. Because I'll tell you, 9 times out of 10, if you ask someone about what could have changed when an incident didn't go the way, or a moment didn't go the way that someone would have liked it to be, is because they felt like they weren't heard. And that's a big thing in nursing, is making sure that your patient is a part of your team and making sure that they feel heard in their care. So, and then the last thing I had is why I chose ProHealth Care. I've worked in a few different organizations. What I find the best about ProHealth Care is their patient-centered care. I feel like the teams really work collaboratively together to make sure that we're providing the best patient care that we possibly can. Doctors and nurses work side by side. They help each other, they talk to each other, they respect each other, and they provide education to each other to improve on a daily basis. ProHealth Care has what's called a just culture environment. I think this is really important. Let's say you made a mistake. We talk about it. Is this a human error? Is this, something you need education on? It's not that quick environment to say that someone is wrong. We really try to talk to each other and make sure that if there was ever a problem, that it would never happen again, and that we're treating each other respectfully. And that's really what that means. And the last thing is supporting our community that we serve. As managers and other people, directors, VPs within the organization, we all do volunteer work within our community. I work with a center in Waukesha County that helps victims of rape with women's health things. They do counseling there, they do family counseling, they do family support. I've done things where it's putting together backpack kits for children who are in need. We've done fundraisers, we've done food share, we've done, you name it, we've probably done it. So I think that's really important too, because we're caring for our patients, but we're also caring for our community that's outside of ProHealth